Hello, my dear listeners. I'm happy to be back. Today we're going to talk about a very controversial topic, thyroid and tiredness. What comes first, chicken or the egg? We have a lot of people who come to our clinic, especially endocrinology office, to ask us to check for the thyroid problem. And patients usually, they're very desperate and they're looking for the answers. We have to grant them definitely fatigue is very unpleasant and may present all different problems. It can be thyroid or it can be related to multiple other problems. How to differentiate? Usually, underactive thyroid and overactive thyroid presents more in female population versus male population. Female, from my observation, they're more sensitive to change of the thyroid hormone. Underactive thyroid, more symptomatic, presents in younger population, usually younger adults and children. So we can notice some growth retardation, change of menstrual periods, mood disorders, and the eating problems. Definitely weight gain and other changes. In terms of elderly people, usually thyroid, especially in mild abnormalities, does not present with any symptoms. And males, they don't complain about the thyroid problems even if they have abnormal thyroid levels. We rarely see male population come and ask us to check for the thyroid levels or for thyroid disease. They already get referred by their primary care with abnormal thyroid function test, and among male population, a lot of people are not symptomatic. So what would we suggest to check first? First comes, on top of the gathering all information, medical problems, we have to check blood work. For underactive thyroid, we usually check two main tests, TSH and free T4. If you Google and go on Google website and start looking for trouble and looking for thyroid problems, you can come across a lot of information. But for non-medical person, it's very hard to differentiate, and we cannot blame. Definitely, you need a big medical knowledge to know what you're looking for. Multiple problems may present with the same symptoms, such depression, menopause, rheumatological disease, anemia. How can we differentiate? So if we screen with TSH and free T4 and person in the normal range, likely patient does not have thyroid disease, even though they present and have multiple symptoms, which can coincide with thyroid symptomatology. In terms of treatment, there are different options for treatment. Majority of the people, they do respond to standard treatment, but there's some other options. There's thankfully a lot of different branded medications. Some people are sensitive, especially with thyroid disease, to gluten, to lactose, and there are multiple options for people with gluten and lactose intolerance to get specific thyroid brand medication. In very extreme cases, we do add combination of thyroid medication T4 and T3. But usually, majority of patients, they do respond to T4 therapy. But patients who don't respond, they still believe that the issue is a thyroid, although they have to look for other problems and discuss with their primary care physicians if there's any other avenues to look and find if there's any other problems may relate and contribute to their feelings, how they feel, and can be helped. Thank you and have a good day. Bye, see you soon.